Assalamu alaikum and good morning, everyone. I'm Dr. Esrat Jahan, working as a research investigator in the Maternal and Child Health Division at icddr. Today I'll be presenting my innovation titled ODOMMO, Invincible Not Invisible, which aims to improve the menstrual health and hygiene among tribal school-going adolescents in Bangladesh. Starting off with a bit of background, menstrual health and hygiene is integral to the well-being and empowerment of female adolescents. The latest Adolescent Health and Wellbeing Survey revealed that around 75% adolescents lack knowledge regarding menstruation before menarche, which is an alarming figure. And this figure is likely to be more pronounced among tribal adolescents as they are a marginalized population and lack access to basic health information. So what is the innovation? It is a peer education model to disseminate knowledge and practices related to menstrual health and hygiene conducted by workshops in schools located in Rangamati. As you can see in the map, the red colored district is Rangamati, and it comprises one of the three districts of Chittagong Hill Tracts. And majority of the population there are tribal people. The peer education model is based on the social cognitive theory and has been proven to be an effective method for disseminating sexual knowledge. So the workshop will be delivered in 3 steps. In the first step, there will be a one-day training workshop conducted for university or medical female volunteers by icddr researchers, that is by us. In the second steps, the female volunteers will then conduct a workshop for class 11 students by a one-day workshop. And in the third step, the class 11 students will deliver the same workshop to class 6 students in the same school. The female volunteers will be recruited from Rangamati Medical College, Rangamati University of Science and Technology, Rangamati Government College, and Rangamati Women's Government College. The training material for the workshop will be co-designed with local stakeholders and will incorporate culturally tailored information and activities. It will consist of quizzes, games, videos, and role play, and will be interactive. And along with workshops for female, sensitization workshops for boys and male teachers will also be conducted to increase awareness. What is the novelty of the innovation? As we are involving female volunteers from the local community, the intervention is likely to be more accessible to the adolescents. As we all know that tribal people, accessibility among the tribal people is difficult. Regarding the second point, acceptance, we all know that adolescence is a period in life where adolescents are reluctant to take advice from family members or teachers and often look upon their peers and follow them. So this innovation is going to be doing the same thing where the peers will be delivering the workshop to the students. And also the innovation will be culturally appropriate as we will be involving local stakeholders in developing the workshop materials. And this intervention will be the first menstrual health and hygiene intervention in Bangladesh to adopt a peer education model, and the first menstrual health and hygiene intervention in Chittagong Hill Tracts to involve male participants. What are the benefits of the innovation? It is a unique innovation for tribal adolescents. Sensitization workshops will build an enabling environment of non-discrimination to promote gender equality. The innovation is cost-effective, sustainable, and scalable. The female volunteers will receive training and networking opportunities from icddr, a certificate of participation, and a reference letter. For the schools, the female adolescents will be going more to school, so they will face reduced absenteeism, and there will be better academic performance. There will also be ripple effects in the community from the intervention, as is shown in the figure, where the female volunteers, class 11 and 6 students, the information, the knowledge that they gain from the workshop, they can disseminate the knowledge to other students in the school and to friends in other schools where the workshop is not conducted, at homes with families and in the neighborhood. So we can see that the intervention will not only have direct benefits but also indirect benefits and outside the target population. The effectiveness of the innovation will be measured by a baseline and post-workshop survey, and a qualitative component will be conducted to design the contents of the intervention. The outcome of interest is knowledge regarding menstrual health and hygiene, which will be measured by the menstrual health seeking behavior questionnaire and beliefs about the attitudes toward menstruation questionnaire. The proposed timeline is 12 months. The allocated budget is around approximately $30,000, which will be divided into human resources, travel, logistics, and procurement. I want to end my presentation saying, Ekshate Amra ODOMMO. Thank you.